Well, good afternoon, and welcome to the Global Pain Association's Virtual Pain Education Series. My name is Ron Aaron Eisenberg. We come to you every week at this time, bringing you the latest in what's new, what's hot, what kind of treatments are available, what ways we can address issues of global pain, because we know people wake up every day with chronic pain, intractable pain. And the idea here with the Global Pain Association is to try to address those issues. And today, we have a very special program. We're going to be dealing with new innovations to relieve chronic pain, spinal cord, and peripheral nerve stimulators. Dr. Ellen Lin will be our presenter. Our sponsors this week are Nevro and StimWave. Nevro is a global medical device company focused on providing innovative therapies that improve the quality of life of patients suffering from chronic pain. Nevro is the only spinal cord stimulation company that offers HF10, an evidence-based and non-pharmacological platform for the treatment of chronic pain, back, and leg pain. They have their website. Check them out, www.nevro.com. StimWave offers full-body, targeted chronic pain relief. Unlike other neurostimulators, there is no battery implanted inside your body. You get to decide if StimWave is right for you during a trial period. StimWave provides the freedom to return to life, the life you control your pain relief from your patient programmer. StimWave systems are full-body MRA conditional. Check out StimWave at www.stimwave.com, and we thank them and our other sponsors for making these programs possible. And we'd like to welcome for a very quick hello the Executive Director and founding board member of the Global Pain Association, Dr. Susan Blackwood, EDD and President of Global Pain Association. And Susan, great to see you. It's been a nice summer. We're heading into August now.
We are, Ron, and thank you and the Eisenberg Group for making this series possible, and to the sponsors that have really supported these series. We could not do it without the donations and the sponsorships from the companies that really care about these chronic pain patients.
And the idea, of course, with COVID-19 preventing in-person, live, large groups, these virtual educational programs have been very successful, have they not?
Absolutely. Our board decided to run them the rest of the summer because we had such great response. People have been writing in and giving us topics, and people have been making donations to keep the series up. And if anybody wants to get a hold of us and they can give us information about topics they'd like, they can go to info@globalpain.org, or they can go to our website, globalpain.org, how to get involved, and they can donate.
Well, we appreciate that. And we're going to bring on our guest presenter today. Dr. Blackwood, thank you very much. We appreciate all your work on behalf of people struggling with chronic pain. Our special guest presenter today is Dr. Ellen Lin. AdvancedPainDoc.com is where you find her. She's founder and president of Advanced Spine and Pain Center, doctor of medicine from the University of Texas Health Science Center, now UT Health, a speaker, lecturer for multiple companies, including Nevro and StimWave, primary investigative role for Vertiflex, a clinical study in her clinic. Dr. Lin followed her patients that had the Vertiflex implant and tracked their progress over a certain period of time. President and founder of the American Society of Women in Pain Medicine. Dr. Lin, I'm looking at you. You look great. Nice to see you. Founder and medical director of the Global Pain Association. And Dr. Lin, you've got a very special presentation today. Before we get to it, tell us what got you involved in the whole question of chronic pain.
Well, as a chronic pain doctor, this is a subject that's dear to my heart. And I want to provide not just the interventional procedures that I was trained to do. I want to get a comprehensive treatment ready for the patients because, as you know, Ron, that you've been involved with chronic pain, Global Pain Society, the patients are very complicated, complex, and we need different modality to treat these patients, not just a physician, but a myriad of different specialties to make these patients functional and have a better quality of life.
Well, you've put together a very special presentation for today for the Global Pain Association's educational series. Why don't we get right to it? Take it away, Dr. Lin. You're on.
Sounds good. Thank you very much, Ron. Anyways, I just want to bring to everybody's attention that chronic pain is epidemic in the US. And gosh, we are spending a tremendous amount of money to help patients with chronic pain. And so we have millions of dollars, billions of dollars actually, pour into these diagnoses in patients who are suffering from chronic pain. And it's very, very costly every year. So the two main diagnoses that come up time and time again in chronic pain is chronic low back pain and arthritis pain. Next slide. And so as you can see, next slide, please. So we have 50 billion Americans. That's about a quarter to a third of Americans suffering from chronic pain. And out of those, 20 million of them have really highly impacted, meaning loss of jobs and loss of function. And so some of these patients are in even higher prevalences. They are women. These chronic pain patients are elderly, veterans, and rural or poverty areas. And so it's estimated about like 500 to 600 billion dollars. That's about $2,000 per person in America we're spending to treat chronic pain. Next slide. So you can see this map of America here. It shows that about a third of the Americans suffer from chronic pain, and these patients actually surpass cancer, heart disease, and diabetes combined. And so I just want to emphasize that it's really important why we're talking about this subject and to bring your attention that we are trying our best in Global Pain Association to help all of the patients and their families suffering from chronic pain to recover and live a better quality of life. So next slide shows that low back pain, the sources of visits is the number one complaint when the patients go to the clinics and they go to the hospitals and emergency rooms, it's about low back pain. So today we're going to talk about low back pain and how to treat low back pain, as well as the second most common diagnosis is arthritis pain. So next slide. It just shows you another slide that shows from the US economy, it's $135 billion a year that's lost of wages and the number one cause of work-related disabilities. So not only we're losing money, we're spending a whole lot of money treating these patients in the clinics and the hospitals, we're also spending the unknown money and unrealized money that's loss of wages because patients are losing their jobs because of this low back pain. So next slide shows that there is high cost of arthritis. Again, this is a second most common diagnosis in chronic pain patients, and $140 billion being spent in extra medical care to take care of these patients. So next slide. So we're looking at traditional treatments for chronic low back pain and osteoarthritis pain, joint pain, right? Physical therapy is most commonly used, and your doctor might give you anti-inflammatories, muscle relaxants, steroid medications, and there are other alternative treatments that may be prescribed to you as well, weight loss, acupuncture, cognitive therapy, yoga, and your doctor might give you some brace to put on your knee or your back because your back hurts, your knee hurts, and he or she might tell you to quit smoking. So all of this, and including injections that I do, may or may not work. If the disease process had been going on for a long time, then some of these things is not going to be able to cover the low back and the chronic pain. So what do we do then? Then the doctors are giving you chronic opiates. Who wants that, right? Temporarily, that's okay, but in long period of time, the chronic opiates can actually give you other health problems that comes along with it. Not even mentioning addiction. There's also GI problems and hormonal problems. You can have decreased testosterone with chronic opiate use. You can have decreased thyroid hormones and increased osteoporosis with chronic opiate use. So So somewhere in between opiates and all these treatments and surgeries, patients are kind of left in between with nothing better to offer them until the field of neuromodulation. So next slide is telling us what it's in the field of neuromodulation, right? So this is what we call stimulators, and we're thinking most people may have heard of the TENS unit, but they've never heard of neuromodulation, and some people may or may not heard about spinal cord stimulation, and peripheral nerve stimulation is really only the last decade that we're venturing down this pathway to help chronic pain patients. So collectively, spinal cord stimulation, peripheral nerve stimulation, and also even deep brain stimulations are called neuromodulation. So you're manipulating the body and trick your brain, your body to think that you're okay, you're not in pain, right? Because pain response is a response where your body thinks it's being injured, so we're going to tell you you're hurt, even though the offending issue is gone. Sometimes patients have already had their knee replacement, their back surgeries, but they still hurt. So what do we do then, right? They're intractable and conservative treatment failed, then we got to find something, which is neuromodulation. So the next slide shows the two things that we're going to talk about within the whole big picture and the umbrella of neuromodulation, which is on the left side of the screen, it says a spinal cord stimulation. That's a picture of a patient who got 2 electrical leads inserted with this little needle. So the needle goes in place, and then the doctors would thread small little computer wires or computer chips into the epidural space, what we call spinal cord, what spinal epidural space, which is in between the bone and the lining of your spinal cord, and then and underneath there's spinal fluid and spinal cord. So it's above that. The picture to the right, it's a peripheral nerve stimulation, and that's a picture of a patient with a knee replacement. You can tell this black T there, that's actually hardware. The patient already had knee replacement, but he still hurts. What do we do then, right? The orthopedic doctors have done their job. You can kind of walk, but every time you step on the knee, it hurts. So this patient had a small stimwave that's placed in there, and the tiny little 4 little dots, it looks like ants, that's actually the conduction site. And then there's a tiny little, I don't know if you can see it, there's a tiny little wire looking thing, and it's a little fainter color. Those are the computer chips called ASIC that's inside. And that computer chip is inside the next to that knee, and there's a nerve right next to the knee. You can't see the nerve on the x-ray, but the nerve, I promise you, is next to those tiny little dots, and it's being stimulated, or the pain is being blocked. So the way that the stimulator works is actually very, very complicated. So I'm going to make it very simple. You can actually get a PhD in neuromodulation, but I'm not a PhD, and nor do I pretend to be like one, but I know these things work, but I'm going to make it very, very simple. It's basically if you have knee pain or leg pain or back pain, and the patients are suffering from that, the message gets passed to the mid-back or at the nerve site. So the nerve transmits the pain signal through the spinal cord and tells the brain, hey, I got right knee pain or right back pain. So through different new medical innovations with Nevro, with other spinal cord stimulation devices, and with StimWave and their peripheral nerve stimulation, the pain signals is interrupted. So you block the pain signal to the brain, then the brain says, oh, I can't really hear you. What did you say? You have pain? No, you don't. And so that's how we modulate the pain signals so the patient can have less pain. So next slide. So who are the candidates for spinal cord stimulators, or any kind of stimulators for that matter, peripheral nerve stimulators and spinal cord stimulators? We're just talking about chronic pain. We're not going to talk about the brain stimulators and whatnot. That's a whole different subject. So these patients who are candidates are very wide variety of patients: chronic pain, chronic low back pain, sciatic pain, or diabetic neuropathy, complex regional pain syndrome. We use it for shingles pain. And there's a very specific diagnosis called complex regional pain syndrome, which have been studied to be very, very effective with spinal cord stimulation and peripheral nerve stimulation. So also, we talked about that chronic pain, even though the patient has surgery, right? So the chronic pain after knee surgery, back surgery, hip surgery, everything looks fine on the x-ray and CAT scan, but why am I still having pain? Those are also really good candidates for neuromodulation or quote unquote spinal cord stimulators and peripheral nerve stimulators. And now we're actually venturing down those patients that are in between their conservative treatment and they're waiting for surgery because you're not old enough to have knee replacement or shoulder replacement or hip replacement. So usually the orthopedic doctors will come back when you're really, really hurt or when you're 65 years old. So you're thinking, no, I'm really hurting. What am I going to do? So this is when the peripheral nerve stimulators come in, and that really has the stim wave, the PNS, we call it, peripheral nerve stimulators, have really changed my practice and the way that I manage my patients' joint pain, and has really improved their quality of lives. And these patients going from not walking to actually, playing tennis, for example. I'll show you a patient later on with a picture that he's actually 80 something years old, gentleman who's retired surgeon. He's now still playing tennis. All right, so next slide. The next slide shows a stim wave example of a patient, young patient actually, with knee pain. And so again, these patients are not quite surgical candidates, whether maybe they're too young or maybe they're too old and their health is not in good condition, so we can't put the patient to sleep, or it's COVID-19 and nobody's doing elective surgeries. We have these devices called peripheral nerve stimulators, and StimWave is the first one to actually come out with all the gadgets to actually help with peripheral nerve and innovatively improve our field of medicine in neuromodulation. So the patient has that knee sleeve, the black knee sleeve you can see on the outside there, and there's a small little pad, and the pad is talking to the tiny little computer chips that's inside of the knee right now. And that battery looking pager thing is the battery that you can change in, change out from day to day, or you can just take the whole thing off. If the patient's not active during the day, he's sleeping at night, you don't need the battery to be placed on the body. So next slide. The next slide shows a spinal cord stimulator. And so this is one of the brands that is very popular now. It's called Nevro. And Nevro has the first non-vibrating, I don't know how, basically in the old spinal cord stimulation, and I've been doing this for 15 years, and I still recall very well, when we implant these spinal cord stimulator leads and batteries, we would tell the patient, where is it vibrating? Where is it tingling? And the patient would feel a vibration in their legs or the back. And then that's how we thought they got their pain relief. Because of vibration, the patient don't feel the chronic pain. Well, it turned out Nevro engineers got real smart, maybe by accident, we don't know, but they turned up the frequency to 10,000 hertz. So back then we were doing it at 500 times a minute, but now it's like 10,000 times a minute. So when you go that high, the patient actually stops feeling that vibration. And not only that, Nevro found out that the pain relief is actually better than the old stimulator that was in the low frequency and vibrating. Okay, so now other companies are trying to use their research, but thankfully the engineers have the patent to protect their 10,000 hertz so that they can't really infringe on their research, because everybody else is trying to mimic this technology. So that's the handheld device. The patient already had the battery implanted inside, but that's a battery device. You can turn up the juice, I call it, so the stimulation higher or lower. But for the most part, patients don't even use this. After they get used to it for a while, they just put in the drawers. I have a patient actually lost the remote control that they don't really use at all. The body gets very used to it, and they just work very simply like a pacemaker, which instead of producing pulses to the heart, these spinal cord stimulation will decrease pain just in and by itself. Okay, so the next slide. So how do you get spinal cord stimulation? So how are these patients triaged, right? So we have the preparation. These preparations have to include a certain things. the patients have had some proper diagnosis, because knee pain is not all knee pains are produced the same. They're caused by different pathologies. You could have osteoarthritis, you could have a meniscal tear, you could have a loose piece of meniscus in there, or you could have infection and nerve pain, diabetic neuropathy, and so the list goes on and on. So the doctor has to make a proper diagnosis so they can treat that pain. And the patient should have tried everything else possible, other conservative things, and to be also ruled out from a psychological standpoint. The patient should not have psychological schizophrenia that's imagining pain, for example. So after all that's done, then the patient will go through 3 to 7 days of testing phase. So what's a testing phase? We put a needle into the part of the body that we want to relieve the pain, and the computer chip or the computer wire goes in through the needle. The needle will come out, and we will put a sterile drape over it. For the next 3 to 7 days, the patients will try it out. So what's trying it out? The electricity gets turned on from the external battery, and the external battery will send the electricity. So you don't have to have surgeries, to try this out. And the patient would have dramatic pain response. For example, the census study that the Nevro company have done, the average pain score, I believe, was 8.5, the census study. And then after about a year, these patients have still a 2 out of 10 pain. So it's a reduction. So during the trial, we're looking for that really dramatic pain relief, or a dramatic reduction in their painkillers, intake. And I've literally had patients during that 7 days have went cold turkey, which is not advisable. That was not my advice, but the patient was so tired of taking the narcotic, he went completely off of the painkillers. And we still laugh about it 5 years from now, that he was withdrawing from the pain medication, but he was without pain. So the number 5 is that patient must have 60%. That's my criteria for myself. Some other doctors will have lower criteria, but I think it has to be 60%. And I'm used to most of the time it's about 80 to 90, 100% of pain relief, meaning the patient would have 8 or 9 out of 10 pain, and the pain reduction would be, on the pain score about 1 or 2 after that 3 to 7 days of testing phase. Then we would go and request for a permanent implantation, and that's minimally invasive day surgery. So next slide. I just want to make you aware of other type of spinal cord stimulations. You might hear about what we talked about, the high frequency, which is HF10 high frequency stimulation from Nevro. There's also other companies that do what we call DRG. You might hear your doctors talking about that. It's dorsal root ganglion stimulation, and there's some science and some research about that as well. And burst stimulation is also discussed, high density stimulation, and then last but not least, the peripheral nerve stimulation we're going to talk a little bit more in detail about. So the only company, again, that has a high frequency is 10,000 hertz. Although StimWave has a high frequency stimulation as well. They go up as high as I guess 1,499. So they're restricted from 1,500 and below. But the advantages of having a peripheral nerve stimulation StimWave is that there's not an implantable battery. The battery is actually not implanted inside of the patient. As you saw in the other picture, the patient just has a battery that's on his knee sleeve, or there are other pictures I'll show you that you can clip it in any parts of the body. So it's very, very versatile. You can, for example, I did a ankle implant yesterday. So the StimWave went into the nerve for ankle pain. So the patient is a very young lady in her early 40s and really intractable ankle pain from CRPS nerve pain. So there's no place to implant a battery in the ankle. There's just no fat to be able to cover it. So we implanted a peripheral nerve stimulation directly at the ankle nerves, and she's had tremendous, pain relief since the trial, and so we were very happy to get her a permanent one, all buried inside for her. So next slide. So the question you got to ask your pain doctors or neurosurgery. Some of the neurosurgeons are doing this now as well, besides your pain physicians. Is the battery, I think the most important question is the battery that's implantable. Well, I know stim wave, it's not implantable, but most of the stimulators are implantable batteries. Are these stimulator batteries MRI compatible? And what does that mean? Is it compatible for the head? What if I need to get a MRI of my gallbladder? Is it compatible there? If I get this stimulator implanted, can I have a knee MRI? And is it full body MRI safe? So most of the time I only implant Nevro and stim wave because of that, because there are both full body MRI compatible. And then this next question is, so how many years do these batteries last, right? So when you buy a car, you're going to ask them, what's the warranty? So the same thing, the warranty, you need to make sure that they have high number of years of warranty. I think minimum, it's got to be like 5 years, and Nevro actually has 10 years of warranty. And I believe StimWave is unlimited just because the battery is not implanted inside of the body. So you can switch it out anytime. Okay. Because that's going to be a cost for the patient to go into surgery and risk repeatedly to go into surgery if the battery lasts 2 or 3 years. Okay, so make sure they have 24/7 tech support. Sometimes things go wrong, and I need the technologist to be and the rep to be around as well, because I need to ask them questions and the rest of it is really just about the doctor's experiences and training in I'm sorry about my facts. In these implantable devices, do they have a lot of experiences in these devices, or are they just kind of new at it, right? And for a new company, which is only about 5 years old, don't quote me on that, StimWave, the physicians, they're not going to go beyond 5 years, just because we're still limited in the patient experiences, number of patients implanted. So these are all questions to ask your physicians if you are interested in these devices to help with your chronic pain. So the next slide shows that the long-term outcomes is really important. And now the neuromodulation space for the physicians are really robust. We really are looking for those clinical trials, the randomized control trials, and the research paper to back up what we do, right? Just because the doctors with an MD behind their names, they're telling you this works, but where's your evidence in that? And I am involved in these research projects, whether it was with the Nevro StimWave, because of that reason, because I want my patients still like me, not just like a month from now, but a year and maybe 10 years from now, that they're still doing well. So make sure that a lot of the patients that are looking for spinal cord stimulators or peripheral nerve stimulators and asking for those research studies. So Nevro still has the highest scientific study, which is called the level 1 study, and it's called the Census study. And they follow these patients and publish the patients after 2 years, and the patients are still doing really well. So the traditional spinal cord stimulator, not that they don't work, they just don't work as well. And you can tell on the average, HF10 gives 160% more relief than the traditional spinal cord stimulations. So the next picture shows that there's a patient that's getting a Nevro spinal cord stimulator trial, and he has a big, huge tape that's just to keep everything sterile. And the little wires went inside already, and we're just giving him a big old temporary battery. These things are non-destructible. So the actual battery that's implanted to the patient is not that big. It's just something that we use externally to go through that 7 days or less of trial or the testing phase. Okay, so the next slide is a StimWave slide of examples. So these are peripheral nerve stimulations. One of the most common complaint is knee pain, right? So arthritis pain. So that's the picture on the right side of a patient of mine. And he has a pad on his knee. He pulled the knee sleeve on, and his battery he puts in his pocket. He usually wears shorts, and he has pant pockets. And actually, the same patient now has 2 knees implanted now. So he has one battery in his each pocket, and he walks just perfectly. So he's still waiting for his knee surgery. He wants to wait until in his 70s because he's so active. He doesn't want to repeat his knee surgery or total knee replacement until he's older. So the patient in the middle is actually a retired physician, and he has chronic ankle pain I was telling you about, and he actually has ankle replacement, but he did never get any better. Still can't play tennis, with his spouse, and so he puts that battery on his inside of his sock, and he plays tennis like that. And the young lady to the left has chronic shoulder pain and also neck pain. So we have placed a lead in the spinal canal to her neck, and then another lead or little wire to her shoulder nerve, we call the suprascapular nerve. And we combine the two leads together, and we were able to use one little battery for her. And she puts it right here on her bra strap, and so it's very convenient for her. She wakes up in the morning. The only time she hurts is when she gets up, and so she doesn't really use it at night. And the next slide is our favorite quarterback. So Joe Montana is a spokesperson for StimWave, and he is a retired quarterback from 49ers. And for those people who are old enough to know him, he's had chronic pain for 30 years. And so I've had the privilege of speaking to him and face-to-face to ask him, how that has been. So he is not on painkillers, and he's very happy with his StimWave. And he was very, very excited to kind of share his stories, anybody who wanted to talk to him about StimWave. So because football players or any athlete for that matter, or people who are getting old, they're going to have different locations of pain. So what's really kind of neat about StimWave is you can have different wires in different parts of the body. With that one battery or two batteries, you can actually power different parts of the body. So instead of taking that hydrocodone or that ibuprofen, and so how I think about StimWave or these little wireless systems is it's almost like Bluetooth. How are you going to use that Bluetooth device for the body? And it's the usage is limitless. And with more research, we're going to be able to push the insurance companies to approve even something like intractable, like headaches and facial pain, not even talking about the arthritis and back pain that's very, very common in the community. I think this is going to really change the way we think about neuromodulation and spinal cord stimulation and peripheral nerve stimulations and to treat chronic pain patients. And the next slide is my last slide, and we actually have our local heroine here. Her name is Monica Caban. So she's a spinal cord stimulator implant patient. She is an Ironwoman winner, and she's a triathlete. And in 2012, unfortunately, she was training for a triathlon. She got ran over by a truck while she was bicycling. And she not only persevered in surviving that trauma, and she suffered from a spinal cord injury. So she was paralyzed from the waist down as a paraplegic. The doctor said you can never walk again, but we have proved them wrong. It's a huge team of people that supported, and I was so honored to be on the part of the team to help her with her pain, because without taking care of her pain, reducing her pain, modulating her pain with spinal cord stimulation, she probably would have never progressed the way she progressed. It's an incredible story. I encourage you to actually look at her website. She has now become a philanthropist in the process of her rehab. She realized that there's lacking in our community for rehab after an athlete is injured and severely injured. So she raises money to help not just spinal cord injury patients, but any athletes and people in need of this type of rehab, and also bring awareness to bicyclists and people who are training on the side of the street to share the roads. And now she's actually walking. And recently she actually was able to take her brace off at times, and she uses her forearm crutches and a little walking stick, and she can actually walk. And I'm just tremendously proud of her. So we can see that she is not only a patient, but she's an inspirational person. And she's now, I have asked her to be a spokesperson for Nevro because of what she went through, and also the positive person that she is, and the most amazing, good-hearted, and the philanthropist that she is. And now she actually still competes in swimming, and of course she always wins. So I encourage everybody to look up her website as a chronic pain patient. She's incredibly inspirational, and it's Monica Caban at nowyousseeme.org. So I think now I'll take some questions.
With one, Dr. Linden, thank you. That was so informative. I almost feel as if I spent a year now in med school, so I appreciate all that detail. For the patient, and I'll use my example, I've had total knee replacement surgery, but while I was experiencing several years of incredible pain, who should I have approached about getting this kind of neurointervention?
I think it's always a good idea to get your primary care doctors involved, and anybody. So let them be the quarterback. Somebody needs to guide you through it. And then they will probably send you to a chronic pain specialist, and these doctors like myself will be able to guide you on what you can do to help with these type of chronic pain.
And if you don't know about these new innovations, can you rely on your PCP knowing?
That's up to actually the pain community, right? So the specialists like me, we need to educate the primary care physicians. I think among my peers, my good friends who are referring patients to me, I think they know very well, but I still need to have lectures like this, but more geared towards physicians. So this is more geared towards patients. And I hope I didn't make it too complicated. I feel like I was at one point kind of going on and on about the science.
No, you weren't into the weeds. It was good.
Thank you.
Oh, you're welcome. What about insurance coverage? All of these devices are expensive. Are they covered by your run-of-the-mill ordinary insurance?
Yes. Medicare, Medicaid, and all major insurances cover this. This is not experimental. Mind you, we've been doing this since 1960s, except now these two companies, one company have done so much research. I think they're so innovative, and the other company is taking the battery out of the components. And so these are not experimental things, but the diagnosis, on the other hand, might be a insurance exclusion. So they may say, yes, you have leg pain, but leg, meaning knee, is not covered because that's your osteoarthritis pain. But because we don't understand the pathophysiology about post-surgical pain, why do you still have pain even after your knee surgery, right? So, but eventually time will catch up.
Now, one of our viewers is asking, what's the recovery time? Are these devices worn for life, or do you grow out of them? Does the pain stop? And are you able to get off the device?
This is very interesting. And now, like I said, I've been implanting these for 15 years. So I actually have one sheriff up north in another county. He swears after he wore it for a few months, his back pain was gone. And I kind of looked at him as like, I don't think so. But there's still pathologies and pathophysiology we don't really understand, right? So, but our goal is through that chronic pain suffering and the patient's not functional at the moment in time, we need to be able to help with that. And so more science and more research needs to tell us what these devices will do in the long run, and we need to track these patients.
Now, we're going to be flat out of time, but before I let you go, for people who would like to talk with you, are you open to talk with patients?
Sure. Actually, if you go into my website, there are little chat or text messages, and you can just text me, and I look at them, my staff will look at them, and you're welcome to kind of just send brief messages so we can answer. without
advancedpaindoc.com.
or SA Pain. There's another link. It's called sapain.com. sapain.com.
Well, Dr. Lynn, thank you. This has been wonderful, and I hope we get a chance to do this again. You take care.
Thank you. Thank you, Ron.
Bye-bye. I'm going to remind folks who've been watching, and we really appreciate you sticking with us. Our sponsors this week are Nevro and StimWave. Nevro is a global medical device company focused on providing innovative therapies that improve the quality of life of patients suffering from chronic pain. Nevro is the only spinal cord stimulation company, as you saw in Dr. Lynn's presentation, that offers HF10, an evidence-based, non-pharmacologic platform for the treatment of chronic back and leg pain. For more on Nevro, go to nevro.com. StimWave offers full-body targeted chronic pain relief. Unlike other neurostimulator systems, there is no battery implanted inside your body. You decide if StimWave is right for you during a trial period. StimWave provides the freedom to return to life. You control your pain, and you control relief as a patient programmer. StimWave systems are full-body MRI conditional. Go to stimwave.com. Well, again, thank you so much, Dr. Lynn. Coming up next week on this weekly program from Global Pain on August 1st at noon on your Global Pain Association Facebook page, our series continues. We're featuring wounded warrior Israel Del Toro, talking about his battle with chronic pain. Israel Del Toro, next Saturday, right here on your Global Pain Association Facebook page. I want to thank everybody for watching, for Dr. Lynn, for this incredible presentation. And on behalf of all the folks at the Global Pain Association, I'm Ron Aaron Eisenberg. Talk with you next Saturday at noon, right here on your Global Pain Association Facebook page. I hope we have a wet weekend, everybody. Take care.